We're now going to demonstrate the treatment of the nasolabial fold using dermal fillers. On this occasion we're going to use Juvederm Ultra 3. We start the treatment of the fold at the upper end and we use the needle externally to assess where our first injection point will be. Are you ready now for us to go ahead? Okay. Wipe the fold using an alcohol wipe. Okay. And we're just going to start now. Assess the correct depth of the needle by bringing the needle up to the surface. You should be able to assess the outline of the needle but not see its silver colour. And just gently inject whilst withdrawing the needle. Okay, and that's the first one done. We then want to go and meet our first line of product. So again, we assess where we might be externally to ensure that we get good distribution. And check that you can see the outline of the needle, but you can't see its grey colour, and that checks that you've got the needle in the correct position. And if we can just ask you just to sit up for me. Okay, and rest back. Fine. We're now going to do some fanning around the edge of the nose to ensure that we fill this corner space. Fanning involves movement of the needle once inserted to place product into different areas through the same single incision. You okay there? Yeah, great. So back into your upper incision. And then use a fanning technique. Okay, and we're done on this side. Now massage the area to make sure there's no lumps to the product. And it can also be a good idea to put one finger inside the mouth and massage with one finger externally. And now we're ready to treat the other side. In the first instance, assess the position of your first injection site using a needle externally. Clean the skin using an alcohol swab. And we're ready to do our first injection. Are you ready?
Yes.
Yeah, wonderful. Well done. Assess the correct depth of the needle by bringing the needle to the surface. You should be able to see the outline of the needle, but not its silver colour. Withdraw the needle slowly whilst placing product underneath the skin. And then the second. Again, assess the position so that you ensure the correct placing of the product. Bring the needle to the surface and then withdraw whilst placing the product. So treat the corner of the nose. You use a fanning technique. Put the needle in using one incision and then fan the product in a triangular position to fill in this corner section. Are you ready? Yeah. and massage the area to prevent any lumping of the product. And you can also put a finger inside and massage with one finger from the inside and one on the outside. Massage the product along the length of the line.